And with me tonight, we have Dr. Margot Roman. Dr. Roman, hi.
Hi, how are you? I'm gonna get my lighting. I feel like I'm in the dark a little
I
bit.
know.
I will get
I'm not a lighting expert.
side. A little bit of lighting. Okay, hi.
I'm not a
So,
lighting expert, but I don't know, I try. So, for those of you who don't know, we are very, very fortunate to have Dr. Roman on this show. She's been so free with her time and she's really, really can help you with anything. So, as you're coming on, don't be shy. Sometimes people hang out in the background, and sometimes we'll just be talking about stuff. But just type your questions in. We get to all of them almost. I don't think I've ever missed a question. So we do a really good job between Lori, who's in the background. Sorry, my gardener just got here. Ansel. Okay, thank you. So just make sure you go ahead and type in your questions and we'll get to them. We'll answer them. So thank you. My husband is, see, I told you he barks at them. Anyway, so Dr. Roman is out of Boston, but Boston, right?
Hopkinton, which is out of Boston. Yeah.
Right. It's just outside of Boston, but it's so for you guys to know that. But she could do consultations. So that's one of the reasons why I bring her on. But one of the better reasons why I bring her on is because Dr. Roman is a holistic, amazing veterinarian and really works hard to heal your dogs. And that's why we have her on. So thank you so, so much for being here.
Thank you very much, and it's fun having a discussion with you because we're always coming into something that we really need to talk about that people want to know about. So that's good.
Yeah, we need to talk about it. People, you know what I've noticed is a lot of times when people will bring a dog to me for whatever reason. I'm not a veterinarian, you guys all know that, but they're coming in for grooming or whatever, and they have an ear infection. And when I tell them, oh yeah, ear infections are an epidemic, they're like, really? Other dogs get ear infections? They're just shocked at how that. Yeah, it's a problem. And so I wanted to talk a little bit about that, but when I always
ear infections are, for most standard veterinarians, that's one of the biggest things they get is ear infections. I actually, ear infections are like, yeah, I'd rather have ear infection than cancer.
Yeah.
Like getting something that is normally there in a normal veterinary practice, but I seem to be getting so many animals that are, at the end point of coming down with everything. Everything's collapsing around them. And I wish they only had an ear infection and be like, oh, that is really, something. But it is really upsetting to people that their dog is, shaking their head, putting their nails in there and, crying.
Yeah.
And, the discharge that's coming out of there,
the smell.
Really, the smell and they're worried about it because they don't want it. They don't know how to navigate it. And the standard of care is to put them on antibiotics, both orally and topically. And, and a lot of times it resolves the symptom, but it comes back again because they haven't really addressed the reason why the animal got an ear infection. Obviously, if the dog went swimming in a lake and they got water in their ear and you sort of know the backstory, of what happened. But many animals will get an ear infection. And as a holistic vet, to me, it's the body's inflamed and it wants to come out of the head. So if the animal has had seizures, if the animal has some mental, issues where it's anxiety or having a discharge come out of the head is a way to remove some of the inflammatory issues in the head. So these are the laws of Hering that have been around for 200 years, are part of the homeopathy laws that things come deeper and come out. And in my homeopathic training, and I was trained with Luc de Schepper back in 93 for like 5 years, studied human homeopathy. And what they said is you don't want to suppress an ear infection. You don't want to push it back in, right? So if there's inflammation inside the body, how can I have that body heal that inflammation versus just pushing it back in? So pushing it back in, he brought up, increasing seizures, increasing things that are inflamed within the body. Like there's something wrong. The body says, I've got a problem. I'm exteriorizing it, right? So if I had an abscess on my arm and the pus was coming out, and I'd say, oh, no, pus can't come out because I can't have it come out. So that's not what we would do. We would want that to come out, right? When it comes out the ears or the eyes or, coming out of the nose, everybody freaks out and says, they got and it's septic infection. We got to put them on antibiotics. We got to, and that to me is not how I react anymore. So what I do is I try to look at the story, look at the backstory, see if there really was some kind of a, dog jumped in the lake and got water in the ear, and that's a problem, or it just happened because the dog is having inflammation, and I don't want to suppress it. So I have a case that this is going back right when I started studying homeopathy, so it's like 1993, when I started studying, and it was a golden retriever that I had delivered this puppy as a baby, and my daughter, who's now 40, I had to deliver the puppies, and I couldn't get my hand in there because the dog was too small. So my daughter was 3, and I said, "Can you go like pull its paw?" you know. And so I used her little hand to pull the puppy out of the birth canal. So I knew this dog from the very, very beginning. Both the mother and the grandmother had horrific ears. It was a golden retriever. The mother ended up having what was called the LaCroix Zep, which is the removal of both ear canals because they were so bad. And that's the ultimate thing that happens is they basically resect the whole ear canal and take the whole ear out. And many of those dogs still have discharges. It just comes out of the skin,
Yeah.
but that's what the resolution is just cut the whole ear canal out, right? So the grandmother had that, and the mother had bad ears, and I didn't know any of the other puppies. They all moved to different places, so I only had this one puppy I was taking care of, and he had chronic ears, and I was still very conventional, and I was using antibiotics and putting him on antibiotics, and just keeping it, just at bay kind of thing. And then I started studying homeopathy and realized I don't want to suppress this. I've got to let this come out. There's some kind of inflammatory thing going on in this dog. And the dog was already like 7 now. And so I really wanted to try to get this dog to really heal. So I told the woman, listen, let me try to, um, you know, do this dog without any, and I'll do it with homeopathy. I won't charge you for my time, but any lab tests or anything that I have to order, I have to charge you for cultures or whatever. And she said,
Right.
fine. So for about a year and a half, I treated it without any antibiotics, without any drugs. I wish I had ozone at that point, but I didn't. And I kept using it. And, the ear never healed up. It still had some discharge, wasn't bad, and was better than the antibiotics that we were using, but still was a discharge. So anyway, I finally said, oh, let's do a culture and see what the culture shows. And I did the culture, and she blew up that I charged her for the culture. And she said, well, you told me you weren't charging me anything. I said, well, I told you if it didn't, I'll do all the labor, but if I have to send it to a lab, she said, so she got pissed off and she went to another vet. And so I hadn't seen the dog in like 3 months. And her son and my son played on the same little league team. And so I saw her out there, and I said, oh, how's Cody doing? And she said, you never could clear that ear. You never could do it. She said, I took it to so-and-so down the street. They put that dog on systemic antibiotic and topical antibiotic, and that dog's ear was clear. You never could do it. I said, but how's he doing now? Oh, he came down with lymphoma. We put him to sleep. So to me, they went, ew, and the immune system went crash, and the dog came with lymphoma. So that was in 1994, I think, that I had that. So that was like my shake you up, pay attention. You don't want to suppress anything if I can get it to heal. So thank goodness, most of the animals that I treat with ear infections, they all heal. I mean, I had another dog, little Milo, who had, no, not Milo, Mizo, a little Shih Tzu who had the same kind of chronic ears for 4 years. The only thing that was offered was LaCroix Zep on this dog. They went to all the top hospitals, top specialists, everything. And when I saw it, it was literally pus was pouring out of this little dog's ears. And he was such a happy guy. Even though he had all this, everybody touching his ears, most dogs would be like cowering away from you. He was still like this happy little guy with these pussy ears up, right? So we screened him for Plechner syndrome. We started on ozone. We did ultraviolet blood therapy with his blood. And I used that material to treat his ears. And he turned out to have this Plechner syndrome, completely healed his ears. He had such thick ear canals. I never thought they would go back to normal. They went back to normal. I mean, they were just swollen. You couldn't even get a Q-tip halfway in.
Wow.
So that completely healed up. And, so I'm telling you extreme cases of ears. But these are the ones that shake me up and say, you got to be patient. You got to let this thing heal
Patience.
and not just throw drugs at it and say, okay, we took a culture and it's sensitive to this. When we do cultures, and this is what I wanted to talk about, is antimicrobial, stewardship, is being able to know when you can use antibiotics and when you don't. The standard of care would be put this dog on antibiotic. Most vets at this point might do a culture. But when we do a culture, we can only isolate probably at the most 12 things that are in there. So what if there are 40 in there and your antibiotic doesn't work with those?
Right.
So if the antibiotic works with 3 of them and you say, oh, they're sensitive, so we have an antibiotic. What if it doesn't work with all the rest of them? You're still giving this dog a systemic medication that is disrupting their microbiome, that totally disrupts their gut. And one course of clindamycin can knock your microbiome out for an entire year, and you may never, ever get it back. So every time we put animals on antibiotics, they're not benign. They are disrupting their symbiotic balance within their gut and their whole, all the flora in our body. There's not just bacteria in our gut. There's bacteria in our eyes, in our mouth, in our, obviously you're putting it systemically, you're trying to get it to the ears, right? So
Right.
all our organs have bacteria that live symbiotically, in the animal. And so
Right.
how do you get that back again? How do you bring that natural balance into the ear when you've been putting so many drugs in the system of the animal as well as topically?
Debbie, I'm going to get to your question real quick. I just want to say hi and also to Victor. But before we do, I want to address 2 things that you were just talking about. One, I think it's so important that you brought up the dog that went from ear infections to lymphoma, because that's the thing. Is I think a lot of times with these ear infections, people think of it as just an ear infection, but if it's treated the wrong way, it becomes a huge, to me, don't you think the ear infection is the warning sign? It's the little, I mean, it feels like a big thing. It's an ear infection. It's painful, but it's the warning sign that something's off. And if you treat it wrong, in my opinion, throwing antibiotics at it without checking to see what we're dealing with, right, it can lead to pretty serious things in the body. It's not a little.
I mean, anytime you throw them on an antibiotic, you can lead to serious things in the body.
Yeah.
So
Yeah.
you can, and many dogs get dysbiotic and they get diarrhea and they get more secondary yeast infections,
Right.
and then they get vaginitis, and then they get, they just roll from one thing to the other because they're never getting back in balance again.
Right.
And with
Right.
the food that we feed, so much of it is filled with glyphosate, which is Roundup, and that has Monsanto has a patent for it as an antibiotic for the intestinal tract. So if most of the dog food has this chemical in it, this herbicide in it, how can we get the gut into its best place? That's really challenging.
It
It's
could be
really hard.
very, yeah. I've seen people and they challenge, but there is something, Debbie, before, because this is really important question she has, but I have to address something with you, because just 2 days ago, I wrote on Facebook that ear infections are not caused by water. And it became a big debate. And now, so I want to get your opinion on it, because I'll just real quick tell you mine, and because I want to see what you think about it. So
Okay.
I believe that if the gut is healthy and there's not something in there, that the actual water would have to have a bacteria in it, like lake water or something. But like water from the groomers get constantly blamed for ear infections.
Right.
So I'm interested in, because I really do believe that if the gut was healthy and the ear was healthy, just getting some water, I get water in my ear every day.
Right.
But
what probably often is that they have an underlying inflammation going on, in the ear. Whether, like I have poodles, I have standard poodles.
Yeah.
So all these doodles and poodles have so much hair in their ears, and so if they get a little moisture in there, and the hair is matted, not matted, but it's down deep in that canal, and it's there, and there's some wax there, and you get some water on it, and the wax is there, and it's tight in there, and the wax is there, then inflammation can start to grow if the animal is a little unbalanced. So just getting in, like one of my dogs, Eliza, she's got more hair on her inside of her ear. It's just amazing. And I tried to clean them without taking the hair out. and there was some wax in there, and it started up an ear inflammation. And
Yeah.
so, and so I had to not manage it. And of course, I'm not going to give her antibiotics because these are
Right.
my fecal donors and I'm not putting them on antibiotics. So it was a lot of ozone. And I ended up using Zymox, which I had never used before.
Yeah.
And it cleared it up. And so I was very happy that I didn't have to use anything except trying to get what I hadn't done is gone down and scoped her and pulled all the hair, every little piece of hair. And once I did that, everything sort of cleared up and
Yeah.
let the new hair come back in. But there
Yeah.
was no way I was putting her on antibiotics for her ear infection. We
Yeah.
cultured it, we did all that, but I'm not putting her on antibiotics. It's completely healed up. And she just has a lot of hair, lots of hair in her ears,
Yeah.
and so, but does water, if the ear has is has it doesn't isn't balanced and the hair is matted in there and they get moisture in there, I think that can sort of grow things because it's like a little cave,
Yeah.
in there, and you're putting more water in there, and when the ears come down and they flap over, it's like starting a mold collection inside their
Yeah.
head, because it can happen.
Yeah. Well, that's pretty much what I say is that
Mhm.
if the ear is balanced and the dog's gut is balanced and everything else is healthy, the
Mhm.
water by itself, I think like my dogs, I wash them all the time. They never have ear issues or anything, but
Mhm.
they're very healthy ears. They're very balanced. I actually don't clean their ears at all. But anyway, I just wanted to clear that
But
up.
I think normal, dogs that don't have any hair down their ear canals,
Yeah.
getting water in the ear, I think, is not an issue at all if they're healthy. But
Thank you.
getting water in a dog that has hair in their ears
Yeah.
or is prone to ear infections that have had them before, it may be enough to tip them, to
Yeah.
make so that they get an infection in their ear. But
Yeah.
the
No,
and so
I agree too. That's what I was saying because somebody had questioned, which I have, just so you guys know, I welcome questions. I'm a debate major. I love, it's not that I want to argue with you, it's that I think that's how we learn. And that's why like I'm okay with saying, "Hey, let's talk about my thought so I could get Dr. Roman's thought because obviously she's a very smart woman." But let's get to Debbie because this is a pretty important topic that we should talk about. So Debbie says her 6-year-old dog has stage 2 kidney disease and Addison's disease. Debbie, I'm so sorry. I'm sure that this is very stressful for you. She gets IV ozone, acupuncture, and chiropractic once a month. How would you best support these conditions? Is rectal ozone better for the kidneys or is IV okay?
Well, all of those using ozone either way. I mean, if with the kidneys, it's a female or male.
We've got to
Okay.
know that.
She gets, okay.
Oh, she,
So
sorry.
vaginal ozone is great. That goes more directly to the urogenital system. So she
Oh,
could put some vaginal ozone up in her. Um, she doesn't have the ability to, give it to her in the bladder, to go up in that direction. That's challenging with the female. So I'm not going to even suggest that. Getting the sub-Q ozone, if you have an ozone generator and get an ozone generator, you can do it yourself and make ozonated saline and give that sub-Q over the kidneys, which would be wonderful for her.
yeah. Yeah. Oh, that's great. See, this is why the questions are so important. If there's anybody out there doing ozone, I hadn't even realized that going through the vaginal would be better. It's
Mhm.
awesome.
So the urogenital system, is very important. I mean, I have a case right now. I mean, it's over, but I mentioned it because I've been talking about this dog Titan for a few months now. But he had a fractured back. He's a rot. If I told you the story in the last thing, he's a Rottweiler who was 14 months old in the beginning of the year and got hit by a car and fractured his back and luxated his whole pelvic, his sacrum, and was told by the university that he would never be able to have bladder tone or anal tone, and that he should go be euthanized. And the owner was just, I can't. He's 14 months old. He's like, love of my life. I'm not going to euthanize him. So they took him to the other campus and they did more X-rays and MRI, and they said, it's the back is like there's a bunch of baby, pieces of bone everywhere. I don't think you'll ever get his anal tone or bladder tone back. We probably can get him to walk on one leg for sure, and the other one probably. So she said, okay, go for it. So they did the surgery. The surgery went well, and the dog got a urinary tract infection. He could walk on one leg, the other leg he knuckled and supported himself. But for 2.5 months, he was in 2 diapers with excoriating diarrhea and bleeding under his tail. And the bladder, he was on chloramphenicol for 2 months, which is a toxic antibiotic that they don't want anyone touching. And his urine was brown and still smelled like dead fish. So when he came to me, he was 2 months post surgically, no control over his feces with diarrhea and bleeding from the top of the bottom of the tail, where just the diarrhea was so it's coming out so badly, and the no bladder tone, where she had to either catheterize him or express him. So he came in and we took him off all the drugs he was on, all his pain meds, everything. We took him off. We did ozone over his pelvis, and I did aquapuncture, B12 injections through the fascia and through the muscles of the back. And literally, I felt like I had to put needles through beef jerky instead of through a muscle. It was just I had to like almost crank it into these muscles on the back, right? And then we did ultraviolet blood therapy because he had a resistant to antibiotics bladder infection, right? So I gave him UVBI, and then we flushed the bladder with ozone and flushed it with ozonated saline. We did that day 1. We did that day 3. Day 4, he actually could wag his tail. We started him on oral microbiome on the first day he came in, but I didn't want to give him rectal because he was on chloramphenicol. I felt like I was just wasting it.
Yeah.
So day 5, we gave him a fecal transplant and did the same thing with the bladder, flushing and everything. Day 6, he had a normal stool and he could urinate on his own, didn't need to be expressed, and he walked 2 miles.
Oh my gosh. Where is he? He was 14 months?
14 months old.
Did I
And
miss how it happened? I don't know if I missed.
he got hit by a car and had a fractured back.
Oh.
So he had a fractured back that was very badly fractured. And they had in the notes, he will never get his anal tone back and his bladder
And
tone
put him to sleep.
And well, this is before surgery. After surgery, I don't know how many made the comment, but they said he's going to have, but they could not control the infection in his bladder.
Yeah.
So he was on this chloramphenicol, which is a really dangerous drug. He was on it for 2 months, right?
What's it called?
Chloramphenicol. It's been taken off the market, but it was sensitive only to that, where the ozone got rid of it in a few days.
Oh my goodness. I know. I love what, if people are just a little more open-minded and not so, just shut the door. I don't know what that is. And so it must not work. And it's crazy because we're seeing it. I mean, I don't think we're seeing enough of it. I don't think we're seeing enough people being more open. Like when I started using the micro bubbles, I mean, people are like, what? And I said, listen, let's just see the results. Like if that'll help, let's just get to the results. I did quite a few free baths myself to try to get, I did exactly like I think all of us will do is we want to help the animals so bad. So if we can, like, I can't, for you to give her your services for free, the other woman, and for her to be angry when you charged her for the labs is beyond me. Because it takes a lot of time. But so where is that dog now? He's a Rottweiler?
Yeah, he's a Rottweiler, and I have videos of him. He runs, he plays with his toys, he's walking, I have other parts of his story that are amazing, but he's walking 5 miles. He's doing great. He's doing absolutely great. And she's just but to have, so this piece is, is talking about why antibiotics are so overused. And the issue with this, which was really terrible, and this needs to be told to veterinarians, we are told that, it says in the insert, please wear gloves when you handle this antibiotic. Do not touch. Where does the antibiotic go? It's supposed to be going to the bladder, right? So wouldn't the antibiotic be in the bladder, right?
Yeah.
Well, this dog is incontinent and she's trying to express his urine. Some of his urine got on the floor, and her 3-year-old walked through it and got head to toe body rash and was in the ER with, in the emergency room. So that has to be talked about, because if you're giving an antibiotic and somebody's sensitive to it and you're thinking you're treating something, and the person gets the child who's 3 years old is in ER, can't breathe, and it's covered with a rash, there's a problem here.
Yeah. Yeah.
There's a serious problem here.
Oh, it's crazy. I remember it's not an antibiotic, but it was flea stuff. A client brought in a dog that she had just put flea stuff on its back. And then she handed the dog over to one of my receptionists. And my receptionist just took the dog and was holding the dog. Within minutes, her eyes started to, we had to take her to the emergency room, my receptionist. And so I'm like, if that's going to have that reaction on somebody, can you only imagine, even if your dog isn't showing a reaction, can you just imagine what it's doing inside to his body? It's just, it's awful. So I wanted to ask Debbie, if you're still there, Debbie, are you able to do the sub-Q fluids, I hope, or the ozone vaginally? I hope you're able to do that, or maybe Dr. Roman can help guide you a little bit through that.
Well, I mean, if you have your own ozone generator, there are videos on showing how to do it rectally and how to use your machine through either bagging or a catheter. They use a catheter with a syringe or a bag, but you can insert that 2 inches or so into the vaginal canal and just sort of seal the lips of the vulva and put the gas in that direction.
Oh, good.
Great for, vaginitis, great for, urinary tract infections too. It doesn't get directly into, you don't have your own machine. Get a machine. It's worth it. It is worth having a machine for your whole family's health.
Yeah. We're not having a veterinarian license. She can only use it for her fam, right? I think there's some
only for her animals. Yeah.
So you have to be really careful if you do get your own.
So you get your own machine, you need to use it only on your animals.
Yeah.
Or if your family wants to use it, you can do that too. But doing it on your own animals, you can't be like running around neighborhood giving it to everybody.
That's why I don't buy one. I'm not kidding you. I don't buy one because I don't trust myself. I don't. I know that's a horrible thing, but I know I would want so badly to help people that I feel like I would set the ozone machine up in my office and be like, I don't know, you could go hang out in there. And
the thing is, I think all the shelters should have them.
I agree.
Instead of putting these animals on antibiotic for upper respiratory infections, when most of them are viral and they're throwing antibiotics at them, it really is sort of, I don't know, just wrong, because they're setting up all these resistant strains, and they don't have another tool, and they would have another tool that works really well.
Oh my
gosh. But they're throwing antibiotics at them.
I know. I work with the animal shelter, and I take in a lot of kittens,
mm-hmm.
but I don't put the kittens on the powdered formula. They go straight onto raw goat's milk.
Mm-hmm.
And they do fabulous. When their eyes open up, they never have upper respiratory infections. And I mentioned it to the animal shelter because I never have to have any of my kittens taken back there for treatment because they're eating the right food. But they don't care. They still, I'm like, you're spending so much more money. I even said I would give them the goat's milk, but no. So this is where we're going to lead into these antibiotic resistance off of Debbie's question, because I think this is one of the main correct me if I'm wrong, but I have an abundance of clients that go in with blood in the urine, usually cats.
Mm-hmm.
They'll have blood in the urine, and then they'll go to the vet. The vet won't run a culture, do anything, say the cat has a bladder infection, and put the cat on antibiotics. So let's talk a little bit about antibiotic resistance and why we need to run these cultures. But Debbie says, can you use the ozone for a UTI instead of using antibiotics? And that's why I want to talk about this.
Absolutely. I don't use antibiotics on my urinary tract infections. If I have a cat that has urinary, if it's not obstructed and it's just a UTI and a female, I'll just give sub-Q ozone. The owner will give sub-Q ozone. They can also, use a vaginal suppository, an ozone suppository, which you can get over the counter. And that helps bring some ozone into the area. But I haven't used antibiotics for a urinary tract infection for a long, long time. And especially this dog that I did, who had resistance to everything, cleared with the ozone.
That's crazy.
And this is going at a university that, claims to have everything, right?
Yeah.
And they couldn't clear this urinary tract infection. And we did 3 injections of ozone, and the owner took ozone home, gave it sub-Q, and we cleared up that urinary tract infection. And the dog's personality went back to where he was. He was depressed. He was insecure. We gave him a fecal transplant, like I said, on day 5. He was bouncing around the next day. Whole different thing, And I think if veterinarians start to connect this gut-brain connection, the immune system, 80% of your immune system comes from your gut. the desire to grab an antibiotic off the shelf because you have 3 minutes to make a decision, it's got to change. They got to say, wait a second. And the USDA has a whole presentation on resistance to antibiotics, and over 700,000 humans die each year in the world from antibiotic resistance. And if people don't wake up and understand that that is as many people that were killed from January to August with COVID around the world, 700,000 people died from resistance to antibiotics. That's every year. So they're blaming veterinarians, they're blaming farmers, and they're blaming physicians that are indiscriminate. Your kid has a cold, put it on antibiotics. It's a cold, okay? It's a virus. You know, the antibiotics, what are you doing with the antibiotics? You know, to do something that for an animal, like, you know, I had a client whose dog had coronavirus, a PCR positive coronavirus, was on 2 different antibiotics, was hacking away, wasn't eating, you know, everything. And I came in and we did ozone, we did UVBI, and I gave it a fecal transplant, and it stopped coughing on the way home. You know, because we were bringing down the inflammation. The antibiotic wasn't doing anything because it was a viral infection.
So that's when we're talking about UTIs.
We're back. Yeah, we should go back. We were on the lungs.
No, that's okay. This one is the one that I get the most, where people are getting on antibiotics because there's blood in the urine. But can there be blood in the urine if there is no infection?
Well, no. First of all, bladders are not sterile. So if they do a urine culture and they say the bladder, we didn't find anything growing, they're still going to put them on antibiotics, right? Because what antibiotics do is they're cooling. And so I can find other things to cool the inflammation down. So let's use cranberry extract and marshmallow root and vitamin C and some echinacea. If you have, you know, you can buy over the counter products like cranberry comfort and things like that. And I just use that, and I use a lot of ozone and even just sub-Q lactated ringers just to keep flushing the bladder, making them drink and pee and pee and pee and drink and pee and pee. You know, obviously with male cats that get obstructed, that is, you know, veterinarians want to react on that very quickly because that can be a very, you know, dangerous thing for a male cat. But if you can get it to dilute and dilute it and dilute it and dilute it and keep bacteria from adhering to the bladder wall with something like cranberry extract, then that's something to try to do. You know, figuring out if they are forming crystals from particular parts of their food is an important component too.
Yeah, well, most of the cats that are going through this kind of thing are usually kibble-fed kitties that I struggle to get them off the kibble because I know, you know, where that's going to lead to. But it's the kitties that are going in. I had a client and her cat, she finally started making the vet run cultures because they just every time. But her cat was a very nervous cat. And so every time anything in the house changed, the cat would bleed. Blood would be in her urine. And so ultimately she found the right vet who said, you know, your cat isn't getting bladder infections. She has cystitis. And so they stopped doing it, and she ended up finding some solutions to it. And I haven't heard from her in a while, so I think things are good, but she had to change that and do some stuff.
Yeah, I mean, interstitial cystitis, which doesn't usually incorporate a bacteria. It's an inflammation of the bladder wall, is very common in people, and animals can get it too. And I'll tell you a story that is really pretty. It puts it in perspective, you know, of interstitial cystitis. It's a human story. And I had a client that came to me with a little papillon that literally could walk on like this, barely walk, like it had been it had been in pain for 6 months, had been to 2 or 3 vets on all this pain meds, could not, barely walk, like 2 steps and stand there, 2 steps and stand there. And they thought if it had cervical surgery, because they couldn't manage the pain at all with any of the drugs, that it probably wouldn't work with cervical surgery because it's not a very successful surgery. So they recommended her euthanizing the dog instead of going and trying to have cervical surgery because the dog was in such excruciating pain. So she came into the clinic and we did ozone and some prolozone over the neck and got her chiropractic adjustment. And 2 days later, the dog's jumping off my chairs in the office, just from jump to chair to chair to chair, right? So she was so pleased, and she's so we were talking. She said, I'm getting ozone for myself for breast cancer, and she said I was in my doctor's office, and she was up in Vermont, and she lives in Massachusetts, and she was up in Vermont, and she says I want to tell you this story. So she says I'm sitting there, and the woman next to me, this is where you're from, and I said Cambridge, and she said so am I. So they figured out they lived 3 blocks or 3 streets from each other,
Oh, wow.
and they were both driving all the way up to Vermont to get ozone treatments. So the woman says to her, I've had interstitial cystitis for 18 years. I have not been able to leave my house. I have been to Mass General, to Brigham and Women's, to every hospital in Boston. I have been to psychotherapy. I have been to I've done everything. I have been in pain. I'm on disability for 18 years. Have no life, right? So she said, I came up here to this doctor, and the doctor gave me one injection into my bladder, pain gone after 18 years. Okay. To
Oh,
think that I suffered for 18 years, right? So she said, well, how did you find this doctor, right? She said, well, I looked up
desperate.
ozone, and there was an ozone veterinarian in Hopkinton. And I called her and I asked her if she would treat me. And I said, I'd only treat paws and dogs with
Yeah.
tails and cats with claws. And I don't, unless you have 4 paws and a tail, I can't treat you. But here is a website, the American Academy of Ozone Therapy, and see if you can get somebody who you can go to. And she said, and to think that I suffered for 18 years. So I have taken animals too that have had chronic UTIs, that have been to the referral hospitals where it had interstitial cystitis. And this one cat who I could not, I normally would put a catheter and flush their bladder, but he was about 20 pounds, totally obese. And when I sedated him, I could not find his penis. He was so fat. I know he had one, but I couldn't retract the prepuce to find his penis. I was working on it, working on it. And I said, he's going to wake up, and he's very fractious, very nasty cat. And what I did is I just gave him ozone gas right into his bladder. And like I was going to do a synthesis of, a cystocentesis. And I just got his bladder, put ozone gas into it, never had a problem again. So he had interstitial cystitis, and it's probably viral, and antibiotics don't touch it. And people keep using the same thing over and over again, and it's not really helping them. And they
Yeah.
get it back when they get stressed because they have a viral load in there. And, none of the drugs that we have are going to take care of it, but ozone does.
That is, gosh, what a great story. I can't imagine 18 years of pain. And then it's such a blessing
Well,
that
to
we
me,
have this.
yeah, but to me, what really, she should have gone back to those doctors
Yeah.
and sued them, I think. Like, why didn't you know about this? I've been on disability taking, I don't know, $50,000 a year from the state,
Yeah.
because I can't walk out of my house without being in excruciating pain. I
It
mean,
is
how bad is that? That's
It is
terrible.
really frustrating when doctors, whether for humans or for veterinarians, don't have the information. I got to tell you, I just went to my doctor the other day, and I'm vegan, and he was asking how I'm getting protein. And I said, oh, I have lots of ways to get protein. You can't get protein, he says. I said, there's protein in spinach, right? And he says, no, there's not. This is a doctor who told me there's no protein in spinach. That's frustrating to me because, and he's been my doctor for a long time, and I actually really like him, but I was shocked, and I don't
Well,
expect the doctors to do
it's really,
everything. Come on.
they don't, and part of it is they're so exhausted. All the medical professionals now are
It's
just,
just,
the veterinarians are burnt out.
but the
Physicians
information's
are
out
burnt out.
there. They should be seeking it. That you should be
Well, they
finding
don't have
ways.
time. They have to, they don't have time. You're trying to give them information, and they just, even my colleagues, they don't want to hear about it. When I talk about antibiotic resistance, I called one of my students that I taught, when I taught at Tufts for 8 years, and she was one of my students, and I called her just because I hadn't talked to her for a long time, and just mentioned the new study that, AVMA came out, AHA came out, and, about you having another choice for using, to have. She said, everything needs antibiotics. I said, what do you mean everything? You have to use antibiotics on any infection. I said, I don't do that. Well, then you're wrong, because you have
Oh,
to use antibiotics. I said, have you read the 2020 whole 250-page from the AVMA talking about judicious use. You need antibiotics. Antibiotics work. I said, they do not anymore. They don't work like they did. And we've got all these resistance rates. She goes, we can agree to disagree. Everyone needs antibiotics. I'm like, okay. I mean, this was a very smart student that I had.
Oh, that's got to be
You know
hard.
what?
I don't want to agree to disagree on that. You're just like,
but I was like, wouldn't you like to know? Nope, not interested. Not interested.
That's heartbreaking. I feel sorry for her clients. I do.
I do too. And she's
very close-minded.
Very close-minded. But that is very typical of the conventional veterinarian that's not willing to explore other modalities and looking at other things. They know the answers. We know we have the antibiotic, we don't need anything else.
Well, it's interesting because if you go all the way back to the 1940s, they used to use probiotics. They didn't use antibiotics like we're using it now. And somewhere along the line, it shifted into antibiotics and not probiotics. But they used to use probiotics for infection. And so
they used to use also bacteriophages for viral infections and bacterial infections. And it's coming back around because we realize that we've overused and abused the antibiotics. So, people are starting to realize we just can't do that anymore. And I'm hoping that more and more veterinarians will, find their way and say, I've got to, and it says in the, in the thing, find alternative ways to treat this.
Yeah.
But the AVMA does, and they don't give them any alternatives to do it. So if all you know is antibiotics and you have no other choice because you don't know acupuncture, you don't know laser, you don't know ozone, you don't know replacing the microbiome to make it so it heals, you don't have a tool. So you have to use antibiotics because you're like, there's nothing else I can think of, so I'll just use the antibiotics again.
Oh, that's awful.
Yeah.
So Janelle, this is a good question. I've never had anybody ask this question, but I think it's awesome. I guess that makes sense because a lot of things are past, but welcome, Janelle. I'm glad you're here. So Janelle wants to know, can ear infections get transferred from one dog to another?
I think so.
Really?
Yeah. So I think if an animal has a bacterial infection and you have the dog licking the ear and then licking themselves and licking, I really, in understanding more about the microbiome, I think when I was a kid, they would say, let the dog lick its wound, it'll heal. Yeah. I think that happened back then because dogs had a balanced biofilm in their mouth. They had normal flora. Now they are so dysbiotic in their mouth that they are probably contaminating the wound with their tongue, right? So if you have an animal that's licking, if they themselves are weak and they're licking all this bacteria and then they're licking their paw or they're licking, whatever, they can be taking something that's dysbiotic, putting into something else that's dysbiotic, and then putting that and making something else in their body dysbiotic.
Yeah, makes sense.
So one of the things that I've done, but I haven't done a lot of them, so I can't say it really works or it doesn't work, but I've tried it on one or two animals and it helped, is I used clean the ear out, used ozone like I do the fecal transplant, and then took some of the hair and wax from my dog's ears and put it in their ear to try to give that bacteria that's balanced into the ear that is all unbalanced because it's been on so many drugs.
Yeah. I've done that with like little infections on like a paw, and put goat's milk on it because it has some good bacteria in it, and it's worked. I'm like, it's crazy.
I mean, Manuka honey on a paw is wonderful because it's just an antimicrobial, but but ozone oil works on some, on paw infections, not so much in the ear canal because it's very wet and a lot of ears, they're too damp in there and the oil makes it damp in there. So it's not the ideal thing for using for ear infections would be an ear stethoscope where you bubble it through olive oil and bubble it into the ears. And that can clear the ear infection.
That's so interesting. You know what is really interesting is what you said about, the dogs licking their own infection, like let them lick their wounds. I have had dogs come in and then people will ask me that. And I always look at the dog's mouth before I say, I think it would be okay. Because the mouths sometimes of these dogs it's awful. It's just, we had one today that my girls all were like, somebody, can we put, they couldn't even blow dry. His poor mouth was so inflamed, and it was just awful. It was just, and the smell, I'm thinking, oh, it's just awful. But
Yeah,
yeah,
I
I
mean,
would never let that dog lick his wound.
I mean that there's so many animals that have such dysbiosis in their mouth, and they have such severe tartar. And so I had a case, a Cavapoo, who came in about 2 months ago and had been in a regular vet. And she said that, it's got bad breath. And so she put it on two different antibiotics. And the dog sort of crashed from the antibiotics. I mean, crashed, and then got pancreatitis and wasn't eating, and was really sick. And when it came into me, it had huge ulcers in its mouth from rotted teeth that had sort of shifted and like put pressure up on the inside of the lip. And so there were like three huge ulcers in this dog's mouth, and he wasn't eating. And so I was like, and had been on Baytril and Clavamox. I mean, had been on strong antibiotics, right? And so we took him, we gave him, ozone. We did UVBI. Gave him a fecal transplant because he had been on strong antibiotics, and I gave the owner ozonate oil to rub into the gums. And I took out the two teeth that were just hanging there. They really, I could pull them with my hand, pulled them out, and then gave her ozone to put all into the gums. And then we had him come back 3 days later for me to try to clean them out. The ulcers were like 90% healed. That's without antibiotics, just ozone, UVBI, and giving him what we have is our oral microbiome water. So my personal dogs, and for almost 30 years, I've had 6 generations, and they have never had one rotted tooth, one piece of tartar, one fallen out tooth, one cracked tooth, one on my cats or my dogs for 30 years. And that is due to the biofilm in your mouth. And most people don't realize that the chlorine and the fluoride in your water is killing your dog's biofilm in their mouth. And also all the different antibiotics and drugs and the flea medications that they're licking is killing the microbiome in their mouth. So we're, like I said, we harvest my dog's water bowl slime. The water bowl water, we call it biofilm replacement water, and people inoculate their dog's water bowl, and then it's like my dogs are sharing their bowl with this dog. And we're clearing up a lot of gingivitis and teeth issues. And in combination with using ozonated oil, it's really a nice way to sort of reboot the flora in the mouth.
So what is that? So it's and do they buy it through you? Where do you get
Yeah,
that?
I mean, we don't have a lot of it because it's my dog's water bowl and they drink the water, but we collect it and we sell it to our clients, and it's what we call it biofilm replacement water. So they take my dog's, I take my dog's bowl and I wipe with a clean hand all the slime off the walls, and then we pour that in jars. And then the owner takes their water bowl water, their water bowl, and they pour boiling hot water and disinfect it, not with any chemicals, and really disinfect it really, really well. Put spring water without fluoride, fluorine, or chlorine, and then put clean water in there, and then put like a teaspoon of mine, like a yogurt starter. And so that bacteria starts to grow into that bowl. And as the dog drinks the water, it's dropping some of its bacteria in, but it's also bringing in some of the new stuff.
Right.
And you do that for a little while. Every day they do the same thing. They try to clean up the bowl, put new stuff in, so that the dog is constantly getting added bacteria that are more balanced. And they can put ozone oil onto the gums to disrupt the biofilm in that mouth, so that there's space for those new bacteria to be adhering to.
Well, I have to get some someday because my dog already has your dog's poop that she ate.
Okay.
So
Okay.
I get some. Now she needs some
Saliva.
saliva. Yeah,
Right.
she's had the poop. That was a challenge. I tell you, that was an
Well,
interesting.
now we have capsules. We have all different things now.
Yeah.
My dogs are rated #1 in the world, so I am the #1 veterinarian who has dog poop.
Yeah. But
So
isn't your poop going to your dog's poop going to animal biome? Is that
yes? So Animal Biome now has our dog's microbiome in their veterinary line. So you have to request it through a veterinarian right now.
Yeah.
So they're going to start mentioning whose it is, because they have it under the raw fed, naturally raised dogs, but they're going to. We're calling it, the Touch of Life microbiome, because the kennel name that I gave my dogs 30 years ago was Touch of Life. So each one of them was Touch of Life, Touch of Life. So that's
Aw,
the name of it, Touch of Life.
that's good.
Plants.
So let's go back and talk a little bit about the ozone through the IV.
Hmm.
So how, if somebody's going to do sub-Q at home and they have the ozone machine, can you,
Hmm.
I know you said there's a lot of videos they can watch, but is it simple to do? I mean, how do
Yeah,
you,
no, it's simple to do. Giving sub-Q fluids, everybody that can learn how to give sub-Q fluids. There are videos all over the internet on how to give sub-Q fluids to your
sub-Q
dog.
just means under the skin, guys. So it's just lifting it.
Yes, lifting up. You have all that extra skin that animals have, and you make a little tent, and you have your IV bottle way higher, so it can gravity feed into the skin. And like tonight, before your show, I gave all my dogs ozonated saline. I do it like once every 3 weeks or so, just because they get bitten by ticks, and I just want to give them a little edge. And I could bring them into the clinic, but this way they don't leave their house.
Yeah.
And they hate it. They don't like it. I mean, they just stand there, but they don't like it. I mean, it's not like, oh, I can't wait to get my ozonated saline. So we give them the sub Q saline. And to make sub Q saline, you need something to make it in. And all the companies sell glassware that you can put saline in. And if it's a small amount that you're going to use, you don't need to get a saline maker, which is a more expensive piece of hand blown glass. But you can get a carafe and then pull it out with a syringe and give it under the skin. But you still sort of need to know a little bit about sterile technique and how to handle things. And so on the videos that they have, you can see those techniques of doing it. But if you have an animal that has kidney issues, or you have an animal with cancer, these are things that you can be doing at home that potentiates their healing ability, because cancer doesn't like oxygen, and you're giving high amounts of oxygen in the system. And if you have an infection, soaking the paw in ozonated saline or water is wonderful. Flushing the ears, and it's wonderful. All of it's wonderful.
So I think you can get the ozone machines on Amazon even. I was pretty sure I
Well,
saw.
no, yeah, you want to go. If I would recommend going to one of the companies that I've recommended, and you can tell them you saw this video and you're interested in those machines.
Awesome.
But they, I usually, my clients know to go there. But there are three companies that I feel have done their. I know what they're going to sell you is ozone resistant. I know that they're going to be reliable, and if something happens to the machine, then they will stand behind it. So you can, for the most inexpensive piece with all the glassware, is probably about $1,100. And then you can get ozone generators that are just $8,000 just for the generator. So you can go all that direction. So the ones I have in my clinic are, and there's some ozone generators now that are like, $17,000. So you don't need that.
Yeah.
You need to be able to generate ozone, in a quality ozone, and then you need the regulator, which is a special regulator for small volumes of air, oxygen coming through. And then I tell people, if they're going to do it for home use, not to buy a surgical oxygen regulator, but to buy a industrial oxygen regulator. And that way you can pick up your oxygen at a welding store, because
Oh,
you're not doing it intravenously. So when you do it intravenously, you want to have it as, if it's 99.7 in the welding store and it's 99.9 in the hospital store, but the hospital oxygen is about 4 times the cost, because after they fill the tank, they recheck the level. Whereas, and it's more important when you're doing the intravenously. So, but to have it at 97.2 is fine if you're doing rectal ozone or doing other things like that.
when I met you, you were out here in California speaking at a convention a long time ago about ozone. Are you
Hmm.
still traveling around speaking?
I haven't done any traveling since COVID. I have
Oh, that's
stayed
right. That's right.
totally, but
Yeah.
normally I am. I'm supposed to be speaking at Western States, which is in Las Vegas, on ozone and microbiome and ultraviolet light therapy. And I'm supposed to be speaking at North American Veterinary Conference. It also, and every year I postpone it because I don't want to travel right now.
Yeah.
So
Yeah.
I said I'll happily do them virtually.
Yeah.
I'm happy to do it
Well,
virtually.
I'm just excited that we're just keep talking, even though I remember I did an event a long time ago with Dr. Patton, and I invited all these veterinarians to come listen to him, and none of the vets wanted to come listen. So I really love that vets like you and all the vets that I recommend are trying to not just educate people, but also speaking with other vets. Come on, guys, we can do better. These animals deserve it. And so I
Right.
just appreciate you so much being there
Oh,
for
thank you.
everybody.
Well,
And
it's hard being, being a person who speaks out. But if I didn't speak out in my own health, I would have been killed by physicians
long,
45 years ago. So
yeah,
you have to be your advocate. You have to question. You have to ask. You need to, and I have a lot of clients that are very intense and they ask a lot of questions and my hope
good.
is that they trust me to do the right thing and they don't take it to the point where you can't do anything,
Yeah,
because they're paralyzed because they don't know what to do. So, I appreciate it when my clients feel like I'm not there to navigate them in the wrong direction. I really want to make sure their animal survives and does well because that's why I'm spending so much time doing it.
yeah.
So,
Yeah. I appreciate clients that ask a lot of questions, and then you can kind of see where it happens. Like they come in, they have a lot of questions they want to ask, and I think those are great. And then over time, the trust builds. But
mhm.
I'm always amazed at the person that doesn't ask any questions. Like, they just walk in and hand me their dog, and I know I'm out a lot, but I just always I want the clients. I love it. I love when they care enough to talk and ask questions. You have to be your pet's advocate. If there's
No,
anything,
you have to be your family's advocate when you go to a physician. Don't just because they're in there 3 minutes and they give you three scripts, doesn't mean that that's the only thing you could be doing.
yeah,
Could you be doing something else to help heal yourself and navigate your health? So
you have to be careful. I just went to my doctor, I don't know, I think it was 2 months ago, and they make you fill out I talked about this on the show before because it's just sitting with me. It bothers me so much. So everybody probably knows this, but my brother committed suicide a couple months ago,
um,
and thank you, but I'm doing okay.
uh,
But anyway, so I go to my doctor, and they
uh,
now have you fill out something that says, "Are you suicidal?" Which I appreciate. Obviously, I'm just coming off of my brother, so I appreciate it. But no, I'm fine. And are you sleeping? Are you all this? I went in because I had a little skin rash on my face. So I say no to everything and everything's great. And then before the appointment's over, she says, "Do you want me to prescribe you an antidepressant?" And I thought, "Well, why? I didn't tell you
that's
I was
terrible.
depressed. I came in for a skin rash. I don't know why I need an antidepressant."
Maybe she got you mixed up with another patient or something.
I don't I wish she had the paper right in front of her, so I don't know. But I just thought, if I
That to me is terrible. If
yeah,
they're
isn't
pulling and they're
that
pushing
terrible?
antidepressants on people, it's like they're robots. They're
Yes.
totally robots.
And
I mean,
before every patient loses,
everyone's
I have to
depressed
offer the
because of COVID.
antidepressant.
We're all sad that we can't go hugging everybody and running to our families and doing all that stuff. Do we need to take
Right.
antidepressants because of it? And then
No.
once you start taking the antidepressants, you can't really get off them that easily.
Yeah.
You
Well,
know?
it's happening with our dogs too. I mean, it's the same thing. I have dogs that are on antidepressants. I have dogs that are on, narcotics for no reason. I had a puppy one time come to me, puppy, 6 months old, and he was on Xanax because mom said he's too crazy. And all I kept thinking was, who's the vet that prescribed this to a puppy? That's what made me
They
very,
need a fecal transplant. That stops so much because that gut brain connection is so real.
it's
So
interesting.
we're taking our puppies now, that I have one or two now that are coming, or more than that. A lot of dogs are coming in. They've been on metronidazole already 2 or 3 times, Panicure. They've had flea products put on them. They've been, have already, 10 vaccinations given to them, and they're only like 10 weeks old, 12 weeks old.
Yeah,
And they're not normal dogs anymore. They're
right.
just over medicated. And so what we're doing is giving them our microbiome from our puppies. My puppies are going to be a year next month. And so we've been saving all their puppy poop. And so I'm trying to inoculate these puppies with the early microbiome, that they had so they can grow into that scaffolding they need to grow and add species on. So I think that's really important to do. And
Yeah,
so, how do you get these puppies that are coming out of, breeders or coming out of places where they just they're not checking the stools. They're just giving them Panicure and metronidazole and Strongid and giving them 2 sets of vaccines before they release them to the person.
Yep. Yeah. No, that's exactly what they're doing. And
Terrible.
they don't even check for the worms before they give him the dewormer. They just give it to him. I'm like,
Right.
you don't even know that the dog has worms. It's an automatic robot thing. So, but real quick, I know we're at our hour, but I love that you talked about a little bit about anxiety and fecal transplant. So Dr. Holly Gantz, I ran a test on a dog a while back, and it was not for anxiety. She didn't even know that this dog had extreme anxiety. This dog happened to be on Trazodone, I think it was. And the anxiety was just off the charts. This woman couldn't even go to the bathroom without this dog just panicking. Anyway, I said, let's just run a fecal transplant. I just want to see, she was dealing with something else. I can't remember, it's been a few years now, why we ran the test, but it wasn't for anxiety. And when the test came back, it had a weird bacteria that came up that I had never heard of, and it was in red. And I had never seen one of the animal biome tests give me this blaring red bacteria. So I called Dr. Gantz and I said, what is this? And she says, that's non-native to dogs. It's common in people who have ulcers. And I said, do you think that could be a bacteria that might cause anxiety? And she says, yeah. So we started a fecal transplant on this dog and then retested. And sure enough, I kid you not, you could track it. I know you know this, but for you guys, I'm not kidding. The anxiety is going down and the red is going down, the amount of bacteria. Like we could just put it together. The woman was able to get her off of the anxiety pills. It was just shocking to me. I was like, wow, here it is right here.
Yeah, well, that's great. She should write up that case.
She knows that. Well, the woman didn't finish. So that was the problem. So, and to be honest, like the woman was moving actually to your side of the country, and her son had schizophrenia. And so there was a lot going on when she had to move. And so she told me that she didn't think she was going to be able to finish the little study that we did. But she was along, her dog's name was Mia. Mia was along long enough for me to watch it happen. And I was absolutely at that moment convinced that anxiety resides in the gut. I mean,
I've had case after case
on it. Yeah.
Just personality changes completely.
Yeah.
And that's like, why would we want to put them on drugs like Prozac or Trazodone or, any of these other SSIs and things like that, when we can just reboot them, give them a healthy microbiome, and their brain seems to, function better because the vagus nerve is communicating properly with the head.
Yeah. Oh, it's crazy. Well, I just can't thank you enough. I know it's really late out there for you guys. Is it hot? Are you guys getting,
no, it's cooling down tonight. Tonight's supposed to be like 70, 65. Tonight, but it's beautiful. It's hot out there now. I heard it's hot.
Yeah, we're getting some bad weather out here. I mean, here's what I will say about California. We were really fortunate this summer. This was one of the coolest summers that we've had until now. Now I'm a little mad and I want my money back for living here. So, who do I talk to?
We had a gorgeous summer too. We've had no rain, and we had almost 10 days of 90 degrees back about 3 weeks ago.
Yeah.
And it wasn't like our normal summer here, but the fact that we haven't had a lot of rain, it's been great. We have no mosquitoes. It's really nice. Yeah. But we need the rain. So we got some last night. We're getting some more, I think on Friday, but it's just, the weather's weird. And that's why, with climate change, we have to make such an effort to feed our animals more plants and not be increasing the amount of death of animals and feeding meat to animals. Because if we cut out animal agriculture, because animal agriculture causes more climate change than our cars and our planes and our heating systems and everything else. And if we could all go and get more plants in our own diet, get more plants in our animals' diet, we can stop climate change in moments. And they say if people all went vegetarian and vegan, that climate change would stop tomorrow. Because
I forgot to tell you, I went vegan.
Oh, I'm so proud of you.
I know. Last time I saw you, you came out and we ate at a vegan restaurant, but I never was able, I just didn't do it. And so I pulled the trigger. I guess I can't quite say I am yet. I'm 5 weeks. I'm 5 weeks in. 5 weeks, not, I haven't
No, I
had.
mean, I think occasionally having like I'll have one of the things I really love is like, organic pancakes. And
Yeah.
so like every other week I'll have one egg and make pancakes,
Yeah.
and so it's from my friends, chickens and their pets, and
Right.
they're not suffering, and
Yeah.
so I mean, I think that there's a balance. That's probably not a balance, but there's ways of
It's
doing it in
okay.
a most humane way
Yeah.
that are you're not, it's not,
Yeah.
nobody's really suffering,
I'll
so.
eventually get back. I mean, my dogs eat a lot of eggs and dairy and like cow's milk, that kind of thing, and then they eat a lot. They're eating a lot more vegetables now that I went the way that
Good.
I went. But and I agree with you. I think at some point I did it to get some inflammation out of my body, and it's already worked. So I'm
Right.
completely cannot believe the difference and how it's made me feel. But I have thought about, because people are like, is that going to be sustainable for you? I'm like, well, yeah. I mean, it's yeah, I think so. But I probably will have an egg, and as time goes by. But yeah, I love it. I wish I would have done this a lot long time ago.
Great. Congratulations. I mean, and the
Yeah,
people that are listening, there's so many opportunities to eat, a variety of things
yeah,
that taste like our regular animal protein stuff that,
yeah.
we don't have to eat them every day, but it can satiate your need for that.
Well, that's what started the conversation with my doctor, because I went in and he says, you lost a lot of weight since the last time I saw you. And I didn't lose a lot of weight, but for me, I'm comfortable weight now. And then I told him what I was doing, and he says, well, you can't get protein from spinach. If everyone needs any help, I'm an hour away and be happy to volunteer at her clinic.
Oh,
I'm
very nice.
RD and want to know and to now be a pet nutritionist. Haha. Thank
Yeah.
you. Our 9-year-old mini golden doodle is in Boston. Thanks, Carrie. Oh, you're welcome, Ellen. Yeah.
Now,
Right.
yeah, so we're trying to put together I want to do the data collection on our microbiome, because when people get a fecal transplant, we send them a survey, and we need somebody, if you know how to do that kind of stuff, we need somebody to do the
I could just tell you, Ellen
verbal stuff.
knows
Anyway,
so much about dog nutrition. Like I
okay,
know exactly who we're talking to. And yeah, you guys would be a great match. I don't know if you need help or whatever, but you guys should
okay,
probably communicate or something.
yeah,
So
let's
keep her
communicate.
name. Yeah, yeah. She knows a lot about nutrition, so she
Great.
could probably be a good benefit. So, all right, guys, I gotta let Dr. Roman go to bed. I'm sure.
Well, no, it's not that late. It's only 8 o'clock, and I have
It's
a
8?
9 o'clock.
Okay, okay. I'm
I
always
have
like,
a
oh my gosh, how late is it there? So,
Well, it's only
but
3 hours, so it's
3 hours.
8:09, and I have a 9 o'clock HVMA meeting, so I have to
Oh,
go let my
oh
puppies
wow.
out.
Wow, wow.
So,
Um,
yeah,
so
so
Ellen
yeah,
says
so
she'll keep in touch with you.
okay, very
Good,
good.
good. All right, guys. Well, thank you so much. Some great questions tonight. I'm not kidding. Like I never thought to ask if an ear infection can be transferred. So that's just some awesome questions. It sounds like Dr. Roman was able to help with the kidney situation that's going on. I really hope that makes a difference to you guys. And I just overall hope that you guys gain enough knowledge that not only will you use it, but you'll carry that on to other people, because it really matters. If we don't keep talking about ozone, if we don't keep communicating these things, then it's just kind of just our airspace, and we really need to spread that. So thank you guys for listening and being here.
Okay.
Dr. Roman, you're just such a blessing to talk to all the time. I love the way you explain things. Like you really get deep into it so we can understand a little bit better. So thank you so much for being
Oh,
there.
you're welcome. You're welcome. And again, we got to take care of these animals, and take care of our planet, and take care of
Yeah,
our families. And,
absolutely.
if you can do it with ways that help make us all better, then why not? Right?
Yeah. Agreed. Behind the scenes is Lori, and
Thank you,
she's
Lori.
fine, but Lori's the one that types all that stuff for you, because if I had to do it, it wouldn't get done. So thank you, Lori, so much, you guys. And we will see you guys next week.
Thank you.
All right.
Take care. Bye-bye.
Take care. Bye-bye.